Today, I would like to welcome Mirella Deisher to the Virtual Hand Surgery and Therapy Summit. Welcome, Mirella, and thank you for joining me today.
Thank you for having me.
So, Mirella, you are a clinician as well as an entrepreneur. Would you like to just let us know a little bit about you, about your career to date?
Sure. So I've been an occupational therapist for 23 years, and I've always wanted to practice in hand therapy. I knew that that was what I wanted to spend my career doing. But I did also recognize when I started working that I didn't have all of the knowledge and the skill set to do so, because we're not really educated to be specialists. So I really was looking for a way to expand my knowledge. And I was fortunate because I was in the city of Philadelphia, where there was a physical therapy graduate program that was open to occupational therapists as well. And it was a certificate in upper quarter and hand therapy. And that really enabled me to build a very solid foundation from which then to further grow my knowledge. It put me in a position where I could start working in an outpatient clinic competently, but also with the recognition and a bit of a roadmap as to how I was going to continue to grow my knowledge. So for the next 10 years, I continued to work in hand therapy, and I was fortunate to be able to then work with hand surgeons. And that's really what pushed me to the next level with regards to the literature that I was reading and just the breadth of knowledge that I was gaining by working with them and their generosity to also teach me. And I just valued so much the knowledge and how it influenced my practice. And I also knew that we didn't get that kind of education in graduate school. So I was always interested in education, and fellowships were the next natural step for me. And in 2012 was when I first started with clinical fellowships. It was a time when I was in a role where I needed to hire hand therapists, and it was very difficult to find certified hand therapists. And because it was an orthopedic clinic with hand surgeons, very fast paced, it can be challenging to take a clinician that does not have experience and put them in that environment, because it'd be very difficult for them to succeed without the support. So I was able to pitch the idea of starting a clinical fellowship in hand therapy where we could hire new grads. They would have the clinical education and mentorship, but they would also have didactic education. And so that's where it all started for me. It was really an opportunity to do what I was dreaming of doing for so long, which was really education. And then within the specialty that was my passion, which is hand therapy. So I did that for a number of years. And then I was getting emails from clinicians that were unable to relocate, even abroad, people from abroad that wanted to do fellowships. And I knew that there was a higher demand than there were opportunities to do fellowships. And I, by then, had completed my doctoral degree. And I had done that largely online. So I would go to campus once or twice a month, but I kind of thought of, why can't we do this online? I could create the didactic curriculum and teach, and people can do the didactic piece online, and then I can mentor them remotely. And so virtual hand to shoulder fellowship came to be in January of 2020. But I had 8 years of experience with fellowships that made that transition pretty natural for me. It wasn't a difficult step. And so then I've just been doing the virtual fellowship since then. And I'm really pleased with how it's evolved. And I'm especially pleased to know that therapists really are seeking this education out.
They absolutely are. So when you were, if I could just go back to when you were doing your certificate training in Philadelphia, how long was that training for?
It was 1 year.
Okay.
And yeah, so it was 4 classes, 4 graduate level classes. And I happened to also be in an outpatient clinic at that time. So I did have the opportunity to apply that knowledge. And I was also a block away from a very large hand center. So I would go to their hand center, and they were also kind enough to mentor me and teach me how to make orthoses. I think any therapist that wants to be a hand therapist knows the value of the mentorship, and really there's a need. So I was lucky because, again, I was a block away from a world-renowned hand surgeons and therapists. And then, within a mile of a university offering this great certificate program. And that was run by Jane Fedorczyk and Mark Walsh, who are very accomplished and well-known clinicians in the realm of hand therapy. So I was just very lucky to have those types of role models.
Absolutely. I did spend 4 days in Philadelphia at the Philadelphia Hand Center with Neil Osterman, and it was sensational. Just even though I had been working in London for 10 years, and I was also in a huge academic hospital with a large team and large numbers of patients and renowned surgeons, it just felt extra special to be there and to just see how the clinics were run and to see the cohesion between the therapist and the surgeon. So absolutely, I can just imagine how thrilling that must have been for you. And also it was the center of education. It's where the upper extremity rehab textbook was born as well. So
exactly.
So you were kind of right in there with these academic experts who are also superb clinicians.
Exactly.
And I think that our environment really does almost determine our career path in a way, because you were very much there from the beginning. And so the seed was planted for you. And I suppose strategically in your mind, you were designing your fellowship for a long time.
Definitely. And I think even before then, as a graduate student, as a clinician, as a student wanting to be an occupational therapist, I always wanted to be like an excellent clinician. I was very committed to being able to serve my patients at the highest level.
Yes.
For me, I think the foundation of being able to do that is knowledge. Knowledge isn't useful in and of itself. I mean, you need to know how to utilize it effectively. So I'm not saying that you have a degree and then, that makes you an excellent clinician. I think the desire to continue to grow your knowledge and to understand problems and to really engage with the process of trying to solve these problems is really where we grow as clinicians. And I just found the opportunity to do that in upper extremity and hand therapy more than any other area. It was just very engaging, very challenging. And then, like you said, I was the role models. It was the Philadelphia Hand Center that I would go to. You can't have better role models. And it was just inspiring to see how excellent they were. And that's really what I wanted to be. So yes, I do think that your environment can influence you.
And so you never really had one special interest, did you? Everything was your special interest. Every corner of hand therapy you decided to master.
Definitely, yeah. It was really about mastering being able to serve my patients at the highest level. So it didn't matter the diagnosis. It mattered that I had the knowledge I needed to give them an opportunity to have the optimal outcome. That's what I wanted to be able to do. I didn't want to, have a patient walk through the door and I look up a protocol and I'm following the steps. I wanted to understand things like to the depth that I could understand them, like from the ground up, so that I could be most effective to help them. And that takes a long time to do that. It takes a lot of effort and a lot of reading, obviously. And so so there wasn't one area, it was all areas that would allow me to give my patients the chance to have an optimal outcome.
I love that. Yeah, and that's amazing. And that's what a fellowship is, really. And then also, I think to become a mentor, you have to be mentored first and be mentored really well. So tell us a little bit about how you mentor and what you love about it.
I love finding people's strengths and helping them recognize their own strengths. One of the things that that I find interesting is how people can feel they're less able than they actually are. A lot of people don't go into hand therapy because they're intimidated by, the complexity of the knowledge that's required. And I really love to help people see that they can do it. So the way that I mentor is really about kind of lifting people up more than anything, because I do think that people are capable of really anything as long as they can believe that they have the aptitude to do it. And sometimes, you need to break things down into smaller pieces for them to feel like they can tackle it. I think that's one of the things that the fellowship does. It structures and organizes the requisite knowledge in the world of hand therapy in a way that is it's progressive, starting with the foundational knowledge, and then it scaffolds gradually more complex concepts.
Yeah.
So I think that the design of the fellowship itself supports also my mentorship style, because it's just a progressive gain in knowledge and the kind of critical thinking that's required within what we do.
I love that. I love that you're that mentor, because I think you're absolutely right. Our field is extremely intimidating, just the depth of knowledge that one needs. I'm sure also embarking on taking this, the exam to become a certified hand therapist is very scary. And I know that you recently, I've seen that you're offering people help with that. Do you want to tell us a little bit more about that?
Sure. So I started doing bi-weekly CHT mentorship sessions because as far as prepping for the CHT exam, a lot of it is strategy. You need to have the knowledge, but I think there are many clinicians that practice hand therapy for years and they never take the exam.
Mm-hmm.
And it's because they're afraid of the exam. The exam, there's on average a 50% pass rate. So a lot of clinicians are intimidated by taking it. So I think just like managing the content that you need to know in hand therapy, if you can break it down into smaller steps and provide some guidance as to how they should approach preparation for the CHT exam, that helps it be something that's more within reach. Yeah. So those meetings are really about planning, strategy, the kinds of content they should be studying, how they should structure their time based on the timeline they've set for themselves to take the exam. I've had conversations with people to extend that timeline. Sometimes they'll be set on taking it in May, and I know realistically for where they're at in their career, what they've done, and how much they know that they probably could use the additional 6 months or so those are the kinds of conversations we have in that session. And again, I just started those, so I think I'll let it take whatever form that meets and serves the clinicians best. So I'll kind of assess things in the next couple of weeks and see how we want to shape those sessions further.
It sounds like you partner with them, which is so nice. They don't feel alone in the venture, and you're right there by their side, which I think is wonderful.
And as clinicians, I think that's what we do. We're collaborative, with our clients. And so as educators, also like being collaborative with the people that we're mentoring and working with, I think that's really important. People have different learning styles. They have different learning paces. So one of the things I really like about the fellowship, and I pride myself in, is being able to accommodate to what that student needs. So I've had students that have had unexpected life events, and they need to slow things down, take a little bit more time with the fellowship. And I like being able to accommodate that, because that means that they're continuing towards their goals, but just within the context of whatever life circumstances they have, they've modified the speed that they're doing that in. I like to see people continuing to move towards their goals and not stop.
Exactly, because there would be that tendency to freeze and stop if it became too overwhelming, or if they felt there was no flexibility from you.
Right.
Yeah, and I mean, there's so much to say about adult learning and how we learn as adults and how we should be educating adults. And it's very much about embedding knowledge rather than, regurgitating facts, because at the end of the day, you're molding a clinician to treat a patient, not be a textbook.
Right. And I think that's the other piece of this. It's about making knowledge meaningful. So I think one of the things, that I'll say about the fellowship, it's not about protocols. It's not about the technical skills. It's about the rationale. Because once you understand the reason behind what you're doing, then you're an independent thinker. You want to be an independent thinker, not someone that is fixed to, a rigid protocol, if you will. Now, protocols are really important. They are based on the way the body heals, based on the procedure. So, they're important. However, sometimes we need to deviate from the protocols if patients are not, they may have unique kind of nuances to their clinical presentation. You want to be able to recognize that and make adjustments in a way that's grounded in science. So you need that knowledge. That's the critical thinking component, that you can't just, as a new grad, no one really has that yet. That's a later progression of gaining knowledge and expertise. However, if you've got the knowledge and you're having conversations about contextualizing that knowledge within clinical scenarios, they start to kind of connect the dots as to how they'll utilize this information, as opposed to just being information they need to learn to pass an exam.
Yeah.
For me, the fellowship is not about passing the CHG exam, because there's a lot of people that will get a book, and study that to pass the exam, and that's okay. However, don't let that replace gaining all of the foundational knowledge that's really going to allow you to serve your patients optimally. And that it always goes back to knowing your anatomy, understanding biomechanics, understanding the physiology of the way the body heals, understanding the surgeries that your surgeons are doing, so that you can support patients in that healing process. All of that is really important.
Yeah. No, and how many therapists have gone through your fellowship?
As far as completing it, I'm not sure. Like, there's about 100 plus therapists that have completed it or are in progression of completing it.
That's wonderful, because through those 100, you're impacting thousands of patients' lives.
Yeah, and I really want to impact, I feel like I'm an advocate for clinicians, because I think that, for all clinicians that I've worked with, all of them really care about being able to serve their patients well.
Yeah.
And they don't have the tools to do that. So, I almost feel like I'm a clinician advocate to give them the tools needed to do what they want to do, which is to serve their patients. And then the patients benefit, because they've got clinicians that are really invested in having the knowledge they need to serve them and to help them have the best outcome, support remediation and recovery of that patient. So that necessitates a certain kind of knowledge, and we don't necessarily leave school with that knowledge.
The other thing we don't leave school with is knowledge of how to become an entrepreneur, how to become, the other person, the business owner, the businesswoman. Tell us a little bit about that journey for you.
So for me, this wasn't that calculated. It was really about continuing to do something that I love. I wasn't able to continue the live clinical fellowships. So I decided to make it virtual, and I had been thinking about doing that just because I couldn't, I knew that there were people that couldn't access fellowships for geographic reasons or financial reasons. A lot of these clinical fellowships, you have to accept a reduction in pay. And it's worth it for the education. It's invaluable education, but not all therapists can do that. So I knew that there was a need for something like this fellowship. So it was something that really came naturally. I don't think it was this entrepreneurial venture thing. I think it came from the heart. And it's just, it's evolved on its own to what it is, I think, because there's a need.
Yeah.
And I love that because I'm really passionate about education. And I made a transition to academia about 1.5 years ago, just to be able to understand our educations and where the hole was in our educations that leave therapists in a position where they feel, that doing hand therapy is so out of reach for them. So it's more about really the need for me and filling that need. And then I totally enjoyed the process of the entrepreneurial piece and exploring that. So it's just something that it's really organic for me. That's the only word I can think of, because it's not like strategic or anything like that. I'm just doing what I love.
I think, or you have an idea and you have that creative component to you, and you want to, it just falls into place that you become this businesswoman, because you have to market it, you have to structure it, there has got to be all of that that's involved. So I get that. I feel that happened to me as well. I wanted to have impact. I wanted to teach. But in order to do that, you have to reach people. People have to get to know who you are and what you're offering.
Right.
Did you have a business mentor?
No, I just, my family has been in business. So not my parents, but my uncle was an entrepreneur. So it wasn't like a foreign concept to me.
Yeah.
But no, not really. I mean, I just literally Googled things, like how do I, what kind of business do I form? How do you form an LLC? And I'm very resourceful.
Yeah.
And I'm one of the things that, I'm not afraid, I'm not afraid to try something and fail. So I just explored, figured it out, and I'm still learning. Again, I'm driven mostly by like the purpose than anything else. I really care about what I'm doing. So that's it. That's kind of like my North Star. And then everything else is just like I figure it out, and I'm just doing my best. And I'll keep learning. It's a learning process. So.
Do you have a team that helps you?
No, but I am starting to offer the fellowship in other geographic locations. One of the things that I want to do is make this more accessible to different parts of the world. One of the ways that I did that was by offering scholarships, because I did the math and realized that there's no way that certain parts of the world can afford in US dollars this kind of program. So I've offered a number of scholarships. And one of my scholarship awardees is in Jordan, and she's partnering with me now. And we're going to start a virtual hand to shoulder fellowship Middle East cohort that'll be, at a time that works for individuals in that part of the world. It'll be priced appropriately for them. And the idea really is that I'm mentoring Noor to mentor others. So she was one of my scholarship awardees. She just completed the fellowship, and I'll be instructing, I'll be teaching, but Noor will always have a presence in our classes. And as her knowledge grows, her role in mentorship is going to grow, and then she'll be an instructor, and also create courses, within the fellowship. And so that's, I'm helping her transition to a role of educator, because there's also the live component. I do live labs where I teach orthotic fabrication, joint mobilization, some of the kind of essential skills we need in hand therapy. And so she'll do that. She's going to come to the States, and I'll teach her, the weekend lab curriculum, and then she's going to be the one doing it. I also have another student that I'm partnering with, and we're also going to, and this is a student from South Africa, actually. And so we're working together on a similar type setup. So that's kind of where I'm going next, is like teaching graduates to teach others, and kind of giving them the opportunity to share their knowledge and teach their peers. So we'll see how that goes. So that, I would say, would be my team.
That is so amazing. I have actually, before Noor did your fellowship, I did notice she was an educator just by the posts she was putting out on social media. They were educational posts in great detail, and she had an amazing flair about them, and, they were just beautiful posts. So again, I think she was drawn to you, and now look, you're reaching the Middle East. And I think that is absolutely fantastic. And you do need to replicate lots of little Mirellas out there, so that, because you can't do it all the time or forever. And that's a very good strategy as a business owner. It's almost an exit strategy as well for you, in a way, if you ever wanted to.
Yeah, and it really came from the recognition that, there are clinicians all over the world that want to serve their patients well, and they don't really have access to the education, the resources. So, it comes mostly from that, and wanting to make it accessible to them. And this will do that, because it will price it in a manner that's, appropriate for their economy.
Absolutely. And I think North Africa would be another great avenue for you, because
my only requirement is they have to graduate the fellowship, so they need to have completed it to teach it. So if I have a Northern Africa student, then I would definitely invite them to think about instructing and mentoring.
So your participation in the summit is going to be spectacular, because you're actually going to be helping us learn one of my favorite joints, which is the wrist. I love the wrist so much. And tell us a little bit about what you're going to be teaching at the summit.
So I'll be talking about examination of the wrist, and it'll be a comprehensive discussion on all of the areas that we can assess for the wrist. And then there'll be a discussion on how to strategize your exam, because what we want to do when we're examining, especially the wrist, is be very organized in our assessment. So we'll go over differential diagnosis. We'll talk about the wrist exam in zones, which has been described in the literature. And so I'll have video demonstrations of how to do different differential assessments, and also why they are provocative for certain conditions. We'll kind of talk about the mechanics behind the special tests and why they're effective to assess for injury of a particular structure. And will you also then teach us and demonstrate all the different clinical tests to perform on the wrist? Yes, we will also have video of how to do each of those. Yes.
Amazing. So a nice practical element to it. And then we will look at, so once we've done assessment in this wrist session, we're also going to look at treatment, which is very exciting, as well as having some surgeons demonstrate wrist surgery to us. Yeah, that's amazing. Thank you so much, Mirella. And where do you see yourself, or do you think you have any other ideas about what you'll create? Because what you've already created is just so valuable to all of us and to the whole community. Is there something else that you think you might do? Or do you think you're going to stick with this?
Well, I think, you always need to evolve things. So I think that I'll look at ways to make it better.
Okay.
And to make sure that I'm utilizing all of the resources, because obviously you see the changes with technology, and how that's changed even how we're learning.
Yes.
I want to make sure that I'm presenting content in a way that maximizes on students' ability to learn. So I think I'll probably just work on evolving it and improving it.
Oh, that's great. Yes. I mean, and technology is there to help us, because not only are we presenting, but we're organizing that content. So I think as we go and as we get that feedback, I know with myself having an online course, I've actually been asked to put it in different languages. Have you been asked that? Have you considered different languages?
I did early on. I thought about putting it in the Spanish language, and it was just such an overwhelming endeavor, because there's probably 60 lectures that are about 2 hours long, and it's a lot of content. So yeah, I definitely early on it was on my wanting to do list, and I kind of put that on the side right now because it just seems like a little overwhelming to take on. But I think that we do need to do that. I think that because we're talking about healthcare here, this is universal need.
Absolutely. And actually, our community is very willing to help us. I've had a German hand therapist volunteer her services. She's an OT, obviously fluent in German and English. I've just got to organize the tech side. But I think it is, if we are going to evolve, that's probably one huge area where we both need to evolve. And that is to look at which languages, first of all, would be beneficial, and then start the process. But it is very overwhelming. I agree with you.
Yeah.
But Mirella, thank you so much for your time and for letting us know so much about who you are as a clinician, where you've come from, what your dreams are for the future. And I just want to say thank you for helping so many therapists, because you definitely are impacting the world and helping so many patients, because really at the end of the day, when we sit down with our patient, we want to provide the best care, and it is for the sake of that patient so that they have their return to function. And it always gives me goosebumps when I think about that, because it always humbles us and it centers us within ourselves and within our practices. And it also inspires us and propels us forward to keep learning and keep pushing ourselves. And I hope one day I get to do your fellowship. It's definitely on my bucket list.
Well, thank you. Thank you so much for inviting me. It was a pleasure.
Thank you. We look forward to your talk. Thank you so much, Mirella.